We're here on behalf of OrthoSpacex on the Podium Life Stories. My name's Neil Jain. I'm a consultant orthopaedic surgeon working in Manchester in the United Kingdom. I specialise in sports injuries and I've got a practice that involves treating elite sports people.
I'm Dr. Assaf Moriah. I'm stationed in Israel and I treat sports and shoulder injuries.
And what we're going to do today is we're going to do a bit of a quick Q&A about someone who sadly is a bit older than my younger colleague here and a bit further along in his career, and some questions that you may have about maybe a future career and anything I can do to help with that.
So, Neil, could you tell me, please, about you think there are critical moments in your early career that shaped your path through?
Well, for me, I've always wanted to be involved in sport. It was just about what conduit would allow me to do that. I wanted to be a doctor because it's helping people. And then it gradually emerged that the best way to work in sport by being a doctor for me was orthopaedics. And yeah, you go through your early training, and as you get more and more specialised, that was when I was able to develop that sporting interest, really.
How do you regularly balance your clinical work with research, with teaching, and your daily basis?
It's difficult. It's very difficult. You've got to be extremely well organised, have good planning, have a good schedule, use what available resources you can. And usually that means a good team, excellent secretary, and still bring enthusiasm to try and fit everything in if you can.
So, how do you approach difficult, complex cases in your daily routine?
It's the good old-fashioned way. Proper preparation prevents poor performance, as some people might say. Got to plan it. The more planned, the more prepared you are for something in terms of a plan A, plan B, plan C, the better. And that starts with you reviewing the notes, reviewing the images, sitting down, even using available resources. We've got more resources now than ever. It used to be just books when I was probably at your stage, and now we've got internet, different facilities like YouTube, lots of online video resources about surgical techniques. And I don't think there's any shame in refreshing your memory about an operation the night before you do it. And I don't think there's any shame in putting up a piece of paper in the corner of theatre with lots of different steps, not just for yourself, but for the whole team, so they can see and know that the operation is progressing.
Do you think you have any routines or habits that helps you, go on with your career and preserve it in the long term?
Yeah, really good question. Probably not in terms of a routine or a habit. What I try and do is bring enthusiasm and energy to every day that I work, right? In Britain, the United Kingdom, rugby is a very popular sport. And there was a rugby player called Sam Warburton, who was the Wales and British Lions captain the Lions twice. And I remember seeing an interview with him once, and I think he writes about it in his autobiography, where I think he was out in Cardiff and he was asked to sign an autograph, and he turned or take a picture, and he was turned the fan away, and his older brother said, "Oh, Sam, take that picture now," and he did, and then he turned around and says, "What was that about?" He says, "Just remember, it might be the 1 millionth time you've done it. It's there first. Make it special for them." And that really resonated with me about patients. This might be the 1,000th time I've sat down with somebody and explained to them what a rotator cuff repair is, what an ACL reconstruction is. For me, for them, it might be the first time that they've even thought about this. And in that situation, you've got to try and make it special for them.
That's a pretty good answer. Great.
I like that.
It's kind of the same. What do you think is the best way to keep improving as a surgeon through the years?
For me, well, what helps me is attending conferences and courses. I'm lucky enough to be in a position now where I'm asked to be faculty on certain courses. But I'll be perfectly honest, I'll learn just as much from other faculty members and even delegates as well, because now I'm faculty on courses that have people from around the world come. And I like to view it as surgeons, we're a bit like artists. You can ask 10 artists to paint a a landscape. Now, they'd all use different techniques, different colours, different skills in order to do it, but each of them would produce an excellent outcome at the end, a beautiful painting. And so that's how I kind of view surgery in a way.
Do you think treating elite athletes is different than regular patients, regular, day-to-day sports?
It's different, but it's the same. So the actual aim of it is to get the best outcome for your patient. That's the same whoever you treat, right? It's not like you're going to treat them any better than someone who isn't an elite athlete. What you have to bear in mind, though, is these individuals are special. They're completely different in a way to Joe Average. And so you have to be aware of those differences when you're treating them.
What do you think is the biggest challenge for you treating elite athletes?
That's a good question. I think potentially the biggest challenge is that your work's on show. So that's a bit of pressure, right? If you do an operation and the whole world sees a person that you've operated on, that's a little bit of pressure. I think the biggest pressure, though, is the demand. So these guys are the top of their game. They don't just want to return to the same level of performance. They want to return quickly to that level of performance. That's a challenge. On the flip side, though, these individuals are more motivated than any patient you have because they really want to get back. They'll commit to the physio and they'll do what they need to do to get there. So it comes with its challenges, but also its benefits as well.
What's your approach to returning elite players to the field without getting re-injured?
Anyone can get a re-injury. Do you know what I mean? So they'll have their rehab, they'll have their targets with the physios and the sports rehab folks trying to match what they can do with each limb or the pre-injury level. But you can never fully guarantee that someone won't re-injure themselves. Did
you learn anything while treating elite patients, elite athletes, that you now put in your regular cases?
Yeah, it's a really good question, that, and I don't think I'm the only person who treated elite athletes that would say this. Elite athletes present with some pathologies that you wouldn't normally see, or you wouldn't normally see as being a pathology that causes patient pain or limited function. Treating them as such and making that pathology corrected and seeing the player return to play has opened my eyes for the general population in that same way. So if they have a similar injury, it actually might be affecting them. It's not a textbook thing that we learn in medical school or even as a registrar, but these subtle things that are symptomatic for elite athletes can still exist in the general population, and so it's worthwhile correcting them as well.